So, Aaron, for adequate lifestyle and for happiness and for general satisfaction, it's very important, no matter where someone is in the spectrum of MS, to deal with their symptoms. And independent from the disease-modifying therapies, we think these are very important aspects to treating patients comprehensively. Tell us a little bit about symptom management.
Well, as we've talked about, symptoms are extremely variable in MS, and they need to be approached differently, sometimes with medicines and sometimes with other strategies. Let's go through some of these symptoms. Let's start with the big three in terms of the frequency that they cause neurologic disability. The first is gait impairment, which is very common in people with MS as their disease progresses. And gait impairment needs to be addressed often with physical therapy. So patients need to be instructed as to better ways to walk, how to improve their balance, and the physical therapist is good for this. A lot of them have spasticity, and getting a good regimen of stretching is a very important first step for them. There is one medication that's approved to be tried in people with walking trouble from MS. It's a medicine known as dalfampridine. It's taken twice a day, 12 hours apart. It's a pill. And it helps approximately 40% of people. The good news is that you find out quickly within a few weeks if it's helping. If it is, you keep a person on it. If not, you stop it. Turning to the second, fatigue. So fatigue is a symptom that's very common in MS, but has a lot of potential explanations. So the management of fatigue starts with trying to understand what might be contributing to the fatigue and fixing those lifestyle issues that might be contributing. But after you've done all that, there are some medications that sometimes help with this sort of unique fatigue or sense of enervation that happens in people with MS. We often try first a drug called amantadine, and if that doesn't work, we then often try a drug called modafinil. Turning to the urinary symptoms, which can include urgency, the need to rush to the bathroom when you first get the urge to urinate, frequency, getting up at night multiple times to urinate, and sometimes, if these problems are more severe, incontinence. The good news is this is one of the symptoms that we have a lot of medications and other strategies that can help. So there are a lot of drugs that are in a class of drugs called anticholinergic agents that can be tried to reduce this sense of urgency. But first you have to make sure that a person is not retaining urine, and that can be done with some simple office tests. There are newer pharmaceutical agents of the different classes that sometimes help, and even Botox in the bladder sometimes helps with urinary symptoms. So there's a variety of ways we can help that. Most people that have urinary symptoms also have bowel symptoms, most typically constipation. And a lot of times you need to explore, again, lifestyle issues with a patient who's constipated. Very often, one of the reasons they're constipated is they've restricted their fluid intake because they think that's going to help their urinary function. So you have to educate them that it's important for them to stay well hydrated. Sometimes they can front load their fluid intake in the early part of the day to try to reduce the amount of nighttime awakenings they have, but they'll still stay well hydrated. We have to make sure that they have adequate fiber in their lives. Another reason for the constipation in some of these people is that, unfortunately, a lot of people with MS either because of their MS disability or for some other reasons don't exercise enough, and we know that inadequate exercise is going to contribute to constipation. So we try to get them on as vigorous an exercise regimen as they're capable of doing. A variety of pain symptoms can be treated.
So now you get into the next three, maybe, like pain, depression, cognitive dysfunction?
Exactly. So pain, again, is a tough nut to crack sometimes. We try to ascertain what the nature of the pain is, if it's a burning kind of pain that often responds to certain medications like gabapentin or pregabalin or duloxetine. Sometimes ordinary over-the-counter analgesics may be helpful, and rarely narcotics need to be given with proper management. Depression is very common in MS. The good news is depression is very readily treatable in MS, and no patient should be allowed to continue with depression unrecognized and untreated, and it usually responds to the same kind of medications that depression outside the setting of MS respond to. And finally, cognitive function, that is really challenging. We don't have any medications that really improve cognition, but patients can learn strategies that help them cope with the cognitive disability. Sometimes that's done through formal cognitive rehabilitation programs, but a lot of times it's strategies that patients often figure out themselves. Write it down, do it as soon as you think of it, use liberal use of Post-it notes, make sure that you try to reduce the amount of multitasking you're trying to do so you can concentrate on one thing at a time. So the symptoms in MS are extremely variable. The good news is that we can approach most of them and help patients.
How about using multiple actions of a given medication across the spectrum of symptoms?
Yeah, so sometimes we'll try to kill two birds with one stone. For example, some patients with pain have difficulty sleeping, so they might respond to a class of drugs called tricyclic antidepressants, amitriptyline or nortriptyline being examples. And if we give those drugs at bedtime, even though these are primarily have been used as antidepressants, they actually work on pain, and they are also sedating. So you can use them to help a person sleep at night.
And their bladders?
And it also helps with bladder management. So that's just one example of multifunctional uses of a drug.